Hi, my name is Carl Aragante. I'm a family therapist and addiction specialist.
Heroin Effects.
What is heroin?
Heroin is an illegal, highly addictive drug. It is both the most abused and most rapidly acting of the opiates. Heroin is processed from morphine, a naturally occurring substance extracted from the poppy seed of certain varieties of poppy plants.
What are the effects of heroin?
Heroin is usually injected, sniffed, snorted, or smoked. Typically, a heroin abuser may inject up to 4 times a day. Intravenous injections provide the greatest intensity and most rapid onset of euphoria, typically from 7 to 8 seconds, while intramuscular injections produce a relatively slow onset of euphoria from 5 to 8 minutes. When heroin is sniffed or smoked, peak effects are usually felt within 10 to 15 minutes. Although smoking and sniffing heroin do not produce a rush as quickly or as intensely as intravenous injection.
What is heroin addiction and abuse?
It is often characterized as a relapsing brain disease that causes compulsive drug seeking and use despite harmful consequences to the individual that is addicted and to those around them. Heroin addiction is a brain disease because the abuse of drugs leads to changes in the structure and function of the brain.
What is heroin withdrawal?
Heroin withdrawal is a physical response when an individual discontinues heroin after heavy use. The initial come-down of heroin withdrawal can vary in time and intensity, although typically withdrawal symptoms begin 6 to 12 hours after the last dose, peaking within 1 to 3 days and gradually subduing over 5 to 7 days. However, some users experience weeks or even months of withdrawal symptoms, and this is known as post-acute withdrawal syndrome, PAWS.
What are the withdrawal symptoms of heroin?
Anxiety, diarrhea, hot and cold flashes, sleeplessness, kicking movements, loss of appetite, nasal discharge, nausea, severe backache, sneezing, twitching, muscle spasms, vomiting, and weakness.